Excuse me, I had mask on my face, and when I washed it, I didn't get it all. So it's like 12:32, and mm, anyway, I'm trying to study a little bit, and I'm not trying to do this for money or personal gain. This is just a study aid that I do. Um, to try to be of assistance. Okay, the heart is a hollow organ about the size of an adult fist and weighs approximately 300 grams or 10 ounces. It has a bold superior base attached to the great vessels and a pointed apex, and immediately superior to the diaphragm. The heart is located between the chest pleural cavities in the mediastinum deep to the sternum. Normally tilted approximately two-thirds of the heart rests left of the mid-sagittal plane. Depending on body size and type, the heart may be positioned more upright in tall bodies or more tilted in barrel-chested bodies. Pericardium. The pericardial sac is part of the pericardium, a serous membrane. The pericardial sac anchors the heart to the great vessels, aorta and venae cavae, the posterior wall of the thorax, the sternum, and the diaphragm. It has a tough outer fibrous layer that does not allow for expansion. It also has a thin, serous lining of epithelial tissue. Wow. Okay, the human heart is divided into four chambers, which can be seen externally. The two superior chambers, the right and left atria, receive blood for the heart, while the two inferior chambers, the right and left ventricles, pump blood out of the heart. Flocci are depressions on the surface of the heart and mark the division of the chambers externally. The coronary sulcus marks the separation of the atria from the ventricles. Anterior interventricular sulcus and posterior interventricular sulcus mark the separation of the right and left ventricles. If you were to look at the internal workings of the heart, you would see a complete wall called the interatrial septum, which separates the two atria from each other. The wall is complete because a hole has closed that existed in the fetal heart. This will be covered soon with blood flow through the heart. The closure of the hole is called the fossa ovals. Another wall, the interventricular septum, separates the two ventricles. These two myocardial walls will effectively divide the heart into right and left sides. Each side of the heart serves as a separate pump for blood. The right side of the heart pumps blood into the lungs, while the left side of the heart pumps blood to the rest of the body. Because the left side's workload is greater than the right side's, the left ventricle has a thicker myocardium. Always look at the outer walls of the ventricles on a dissected heart or illustration to determine right from left. You can also see the presence of the valves in figure 10.6. The atria are separated from the ventricles by the atrioventricular valves. The tricuspid valve lies between the right atrium and the right ventricle. Goodness, this is boring. I don't mean to say it's boring. It's not boring. It's just that I'm tired. I'm going to end this stream.